we're getting to make a difference in the lives of millions and millions of people around the world. It's truly a global effort here that's coming to being. So the Health and Pollution Fund is intended to be available to all locations in the developing world where, firstly, there's a strong health component where people are suffering, especially children, from pollution issues.
The WHO estimates that 20 to 25% of deaths are related to an environmental agent, and these are occurring in developing countries. So this is completely a preventable statistic. There's no reason in this modern day and age that children should be dying of environmentally related disease.
Children are very sensitive to environmental pollution, much more sensitive than adults. There's several reasons for that. The first thing is that children live very close to the ground. They play in the dirt. They're constantly putting their fingers in their mouths. That gives them a mechanism. They transfer pollutants like lead, pesticides from the environment into their bodies. On top of that greater exposure, children are inherently more vulnerable. They're biologically more vulnerable. And we know that the consequences of those early exposures can be devastating.
This is a time of global recession and financial meltdown, and people are wondering whether the countries around the world are going to be able to coordinate. Public health is an example. You have a lot of work done on vector diseases, infectious diseases. Environment is another area. Climate change is a field where people are working together. But there's this disaster that's hiding in plain sight, which somehow is a gap in the multilateral funding framework, and that is financing for cleanup of polluted sites. The other thing that's attractive and important about the Health and Pollution Fund, it's also about empowering people and communities into doing something that benefits them.
I think it makes a lot of sense to harness funds from multinational organizations to control pollution in developing countries. What the banks and other international organizations have to come to understand is that it costs countries a lot of money to permit populations, especially populations of children, to be exposed to chemicals like lead and pesticide. Those exposures to those chemicals erodes children's intelligence. It therefore erodes their ability to be economically productive when they grow to adult life. And widespread exposure of populations to chemicals, especially to chemicals that are toxic to the brain and nervous system, basically condemns whole societies to an endless cycle of stupidity and poverty.
The Health and Pollution Fund is needed because there's no other source for cleanup money for these sites. There is no WHO fund, there is no World UN fund that has a mission to go out and provide cleanup.
These are acute human health problems, acute public health risks, acute problems for children. The one thing that shouldn't hold this up is money. Over the next several decades, we'll be able to go out and implement this work around the planet. Our children will thank us for it, and the generations of people that live in these toxic places will be able to live productive, healthy, capable lives.